And it is time for our HealthLink Idaho. You know, Idaho consistently ranks among states with the highest rates of suicide. In 2021, Idaho had the 12th highest suicide rate in the country. And the Idaho Department of Health and Welfare, in close collaboration with many advocates, organizations, and individuals impacted by suicide, is actively working on solutions to reduce suicide rates in Idaho. So we have with us Lee Flynn and Stuart Wilder. We're going to be talking about how Idaho is making efforts to reduce the rate of suicide right here and how we can all help those who might need that support. Great to have both of you here. A very important topic and a heavy one at that, but one that we do need to bring light to. So I want to begin with asking, how does Idaho's suicide rate compare to other states?
Sure, thanks for having us on.
Yeah.
I appreciate it today. So Idaho consistently ranks in the higher end of states with the highest rates of suicide. And typically the Idaho's ranking at about 40% of the national average, above the national average for suicide prevention.
Wow, okay, so above national average. That's a number that we definitely would like to change. What are some of the efforts, though, to reduce suicide here in our state?
So I'm here today with Lee I co-chair the Idaho Suicide Prevention Action Collective, which we call ISPAC for short. And ISPAC is a statewide group of public-private stakeholders that are tasked to develop the 5-year suicide prevention plan and to oversee the actions to implement that plan. We just had a governor's executive order that charges now ISPAC to report to the legislature and back to the governor. So it's a collective effort with all of our partners, including the hotline, other nonprofits, NGOs, Department of Education, Department of Health and Welfare as stakeholders. So those are big efforts as far as working collaboratively across the state.
All right, so it's great to hear, though, that we are working towards those solutions and acknowledging that there is such a great need. What are the warning signs, though, for suicide risk in a person that maybe someone close should be keeping an eye out for?
Yeah, it's important to recognize that there's no single reason for suicide and there's no single, kind of path away from suicide. But that said, it's really important that people, in families and communities, understand some of the warning signs and risk factors. And so some of those are, to really pay attention to how a person's talking. If you know someone and they're talking about suicide, or if they're talking about not wanting to live any longer, or if they're talking or expressing that they feel like they're a burden to others, those are really important things to notice and pay attention to. And then similarly, when a person's behavior might change, what that could look like is maybe increased use of drugs or alcohol, or maybe a person that's struggling with mental illness, depression or anxiety, things like that. And another thing to watch for is if you notice someone, it starts to give away all of their possessions. Those can be really, really important things to notice because it can signal that they may be thinking about suicide. So those are some things, and I'd say as far as behavior, another thing that a lot of people notice is, there can be kind of, things that look like the person is struggling, but another behavior to be mindful of is if a person has been struggling and then all of a sudden they have, a lot of improvement, a quick improvement. It sounds kind of nonsensical, but that can be something to pay attention to also. So I'd say on balance, when we're around our loved ones, when you notice that someone is not themselves, that's a time you might want to check in.
And probably a little gut instinct too, right?
Exactly.
Yeah, I mean,
exactly.
Trust your gut. You know this person, and if something just feels off, it's worth talking about, right?
It's absolutely worth talking about, yeah. And that's exactly, I think we couldn't say it any better. It's like, we all know our loved ones better than anybody else. And so if something just doesn't feel right, it's better to check in and try to ask what's going on than to not. So.
Yeah, exactly. And when it comes to family members, if we have that gut instinct, or a friend, right, and we're concerned that someone might be considering taking their life, what do we do?
This is hard for a lot of people, but the most important thing that any of us can do if we're concerned is to reach out to our loved one, it's a family member, friend, neighbor, and ask them how they're doing. And you could say something like, I've noticed that you don't seem yourself lately. You're not engaging in activities that you usually like to do, and you're really withdrawn. Is everything okay with you? And and then just actually ask them, are you thinking about suicide? And it's important to use the word suicide rather than saying it a different way, because that indicates to that person that you are safe to talk to.
Yeah.
You could get different reactions. A person could say, "No, I'm not thinking of suicide. Why would you think that?" But they could also, say, "Actually, I am," and then that opens the door to us, as members in our community and family members, to really reach out and help that person get the care that they need.
So if someone watching needs to learn a little more about suicide prevention and the support and services, where do they go?
So there are different resources. Department of Health and Welfare Suicide Prevention Program has a lot of great resources online. I work for the Idaho Crisis and Suicide Hotline. Our website has information as well. One thing I wanted to also mention is that on our website and other websites, a person can actually look at a safety plan, and so there are resources like that for family members or individuals. And any other number of resources out there can be very helpful.
There's some other nonprofit advocacy groups like American Foundation of Suicide Prevention and NAMI Idaho are also resources that people can look into.
Stuart, Lee, thank you both so much for bringing light to
You
this
bet.
really important topic.
Thanks for
really
having us.
appreciate it.
Thank you.
Everyone stick around, a lot more to come on Idaho Today right after the break.